Welcome. Today, we're diving into the fascinating world of medical rays, those powerful, invisible forces that allow us to see deep within the human body and treat various conditions. From X-rays that reveal bones to gamma rays that target cancer cells, each type of ray has unique properties, uses, and safety precautions. Let's explore how they work, what they're used for, and why they're so vital in modern medicine. Let's begin with one of the most familiar rays in medicine, the X-ray. X-rays are primarily used to create detailed images of bones and hard tissues. They are essential in diagnosing fractures, infections in the lungs, joint problems, and even dental issues. X-rays pass easily through soft tissues but are absorbed by denser materials like bones, which then appear as clear, contrasting images. Here's a practical example. If you have a suspected fracture, an X-ray can pinpoint the exact location and severity of the break, helping doctors decide on the best treatment. The process is usually quick, taking just a few minutes, and the images can be immediately reviewed by radiologists. However, X-rays do involve exposure to radiation, which means repeated or prolonged exposure could potentially increase the risk of cancer. That's why medical professionals use protective shields, lead aprons, and other safety measures to limit exposure. Generally, the benefits far outweigh the risks, especially when X-rays are used only as needed. Who should avoid X-rays? Pregnant women are advised to avoid X-rays unless absolutely necessary, as radiation can affect fetal development. Children are also more sensitive to radiation, so they may receive alternative scans, like ultrasounds, to minimize exposure. For individuals with metal implants, such as joint replacements or dental fillings, X-rays are generally safe. However, the metal can cause distortions, known as scatter and artifact effects, which may obscure certain details. Technicians often adjust the angle or intensity of the X-ray to get a clearer image, ensuring accurate diagnostics without unnecessary exposure. Next up, we have gamma rays, known for their powerful, high-energy properties. Gamma rays are crucial in cancer treatment, where they are used in radiation therapy to shrink or eliminate tumors. This is achieved by directing gamma rays precisely at cancer cells to damage their DNA, preventing them from growing or spreading. Gamma rays also play an important role in PET scans, positron emission tomography, a type of imaging that helps track how organs function. In PET, a small amount of a radioactive substance is introduced into the body, and as it moves through organs, it emits gamma rays that are detected by the PET scanner. This creates detailed, 3D images of the body's activity, which can reveal issues like brain disorders, heart problems, or cancer spread. While gamma rays are effective, they come with risks. Since gamma rays can damage healthy tissue, careful planning and precision are crucial. Doctors often use advanced imaging and computer models to guide the rays precisely, minimizing harm to surrounding tissue. Individuals with certain health conditions, like compromised immune systems or prior radiation therapy in the same area, may need to avoid additional gamma radiation. Pregnant women and young children are also at higher risk from gamma rays and should consult with healthcare professionals to explore safer options. For patients with metal implants undergoing gamma ray treatments, especially in cancer therapy, precision is key. The implant's location in relation to the treatment area can influence the targeting. Doctors use advanced imaging to plan the ray's path and avoid unnecessary exposure to the metal, ensuring safe and effective treatment. Infrared rays might be lesser known, but they are incredibly useful, especially in physical therapy. Infrared rays are used to generate soothing heat that penetrates the skin's surface, helping to reduce pain, decrease inflammation, and improve circulation in targeted areas. They're commonly used to ease muscle tension, accelerate healing of soft tissue injuries, and enhance overall blood flow. Infrared therapy is considered safe, as it doesn't involve radiation. However, its effects are mostly superficial. It doesn't reach deeply into tissues like some other therapies. Nonetheless, it remains a comfortable and non-invasive option for pain relief and healing. People with conditions that increase sensitivity to heat, such as those with inflammatory skin disorders or cardiovascular conditions, should consult a doctor before using infrared therapy. Those with implants, like pacemakers, should also seek medical advice, as the heat may interfere with certain devices. Ultraviolet, UV, rays are famous for their role in sunlight, but they also have several medical applications. UV rays are commonly used to treat skin conditions like psoriasis, eczema, and vitiligo. In these cases, controlled exposure to UV light helps reduce inflammation, slow down excessive cell growth, and promote healing. UVB rays, specifically, help our bodies produce vitamin D, which is crucial for bone health, immune function, and even mental well-being. Many people with vitamin D deficiencies are encouraged to get limited sunlight exposure to activate vitamin D production naturally. However, UV rays can be risky if not used carefully. They can increase the chances of skin aging and even skin cancer if overused. Therefore, UV therapy should always be conducted under professional supervision, with exposure times and intensities closely monitored. Individuals with a history of skin cancer, severe photosensitivity, or certain autoimmune disorders should avoid UV exposure, as it could worsen their conditions or increase cancer risk. Children and pregnant women are also typically advised to avoid UV therapy. Lasers have transformed medical treatments with their precision. From eye surgeries like LASIK to cancer treatments and cosmetic procedures, lasers offer incredible accuracy. They work by producing a highly focused beam of light that can cut, burn, or destroy tissue very precisely, minimizing damage to nearby areas. In LASIK eye surgery, for instance, lasers reshape the cornea to improve vision, often eliminating the need for glasses or contacts. Similarly, lasers are used to treat certain skin conditions, remove tattoos, and even eliminate small tumors. The benefits of laser treatments are clear: faster recovery times, less pain, and minimal bleeding. However, laser procedures are often expensive, require specialized equipment, and need to be performed by highly trained professionals to ensure safety and effectiveness. Pregnant women and people with certain medical conditions, like active infections or specific eye diseases, may need to avoid laser treatments. Those with light-sensitive skin or certain medications that increase sensitivity to light should also consult with a doctor before undergoing laser therapy. For those with metal implants, lasers can sometimes reflect off or be altered by the metal, which may increase the risk of burns or unintended tissue damage. Before any laser treatment, always inform your healthcare provider of any implants. They'll adjust the approach, ensuring the laser therapy is safe and effective. Unlike the other rays we've covered, ultrasound relies on sound waves instead of radiation, making it one of the safest imaging options. Ultrasound is widely used for examining internal organs like the heart, liver, kidneys, and particularly for monitoring pregnancy. Ultrasound waves are emitted into the body and bounce off tissues to create real-time images, helping doctors observe blood flow, organ function, and fetal development. Since it doesn't involve radiation, ultrasound is safe for repeated use, especially in sensitive cases like prenatal care. As we've seen, each type of ray has unique strengths and limitations, allowing doctors to choose the best option for different medical needs. From diagnosing bone fractures to fighting cancer, these rays enable safer and more effective treatments every day. Medical technology continues to evolve, with innovations that make rays more precise and reduce risks. As science progresses, who knows what new possibilities will open up? Thank you so much for watching. If you enjoyed this video, don't forget to give it a thumbs up and subscribe to the channel for more content like this. Until then, take care and see you in the next video.